My name is Dr. Sharad Damodar. I'm the head of adult hematology and BMT at the Mazumdar Shaw Medical Center in Narayana Health City in Bangalore. Now, the bone marrow transplant unit at Narayana Health City was established way back in the year 2004. And since then, over the last 20 years, we've done more than 2,000 odd bone marrow transplants till date. Now, the unit here is a big referral center both for adult and pediatric bone marrow transplants. Now, essentially, bone marrow transplant is done for various diseases. Diseases can be both cancerous and non-cancerous diseases. So, among the non-cancerous diseases, the commonest indications for bone marrow transplant are diseases like thalassemia, sickle cell anemia, aplastic anemia, and some of the immunodeficiency disorders, for which the only cure is completely changing the bone marrow from another donor. The donor can sometimes be your own sibling, and sometimes it can also be a parent or a child who is half matched. And rarely we also use an unrelated donor from some of the registries which are available when we need somebody who does not have a donor available. Now, in addition to non-cancerous diseases, cancerous diseases like leukemia, MDS or myeloma, lymphoma also require bone marrow transplant as a curative intent treatment. Now, for the leukemias, again, it is an allogenic transplant where we are taking cells from a donor and using that to replace the diseased bone marrow and thereby achieve a cure. So, these are allogenic transplants. Now, for diseases like myeloma and lymphoma, we do something called autologous stem cell transplant, where you use the patient's own cells. They are collected when the patient is well, and then a high dose of chemotherapy is given and put back, and these are called autologous stem cell transplants. So, these are commonly done for lymphoma and for myeloma. Now, clearly, bone marrow transplant is certainly a curative intent treatment for all these disease subsets. And this is a referral center for this kind of high-end treatment, which is kind of now accessible to most patients in the country and in our surrounding countries. Now, the next treatment beyond this is something called immunotherapy, where you are trying to take the patient's own cells and use those T cells to go back and kill off the cancer cells. And this kind of immunotherapy is called CAR T cell therapy. Now, CAR T cell therapy is one of the newer innovative therapies for which this center here is one of the